Hello everyone, my name is Jessica, 5th year medical student, and welcome to my third episode in a coronavirus series where I read the news so you don't have to. And today I'll be talking about Africa's response to coronavirus. Now, Africa is a very big continent with over 54 countries and a massive landmass, but it has managed to stay ahead of the curve and save lives and have very few cases compared to the rest of the world. So today I'm just going to explore some countries' response to corona, from drones to politicians giving up their own money and much more, and even one country claiming they have a cure. So stay tuned and let's get into it. So first we're going to start with Senegal. So Senegal is a country in West Africa with a population of 16 million people, and they are testing absolutely everybody, symptoms or no symptoms. And the way they're doing this is that they are repurposing tests that they were using for dengue fever, and they're changing them a little bit so that they can be able to test for coronavirus. This is great because they only have 50 ventilators for the 16 million population that they have. And also, they're also tackling the ventilator situation as they have Senegalese engineers who are 3D printing ventilators. So these ventilators that they're printing are $60 versus if they were to import ventilators, which would be $16,000 each. So they're being innovative and pooling on their own resources in order to save money and save lives.
Researcher Amadou Sall.
There is no need for a highly equipped lab. It's a simple test that can be done anywhere. The idea is to rapidly produce 2 to 4 million kits, not just for us, but for African countries, so that we can detect and isolate patients quickly.
Al Jazeera reports Senegal as the country with the highest recovery rate in Africa and the third in the world. Okay, next we'll move to Ghana. So Ghana is a West African country with a population of 29.8 million people. Like many countries worldwide, they've imposed a lockdown, and with lockdown that means people can't go to work and make money. So this is an issue. But what Ghana's president Nana Akufo-Addo has done, he's given 3 months worth of free water. And then due to public pressure, he's also given 3 months worth of free electricity to those who are the poorest of the poor, and then 50% slash to this electricity for every other person. And also then the next thing that Ghana has done, which is very exciting, is so Ghana only has 2 testing centres in Accra, their capital. So in rural areas, what would have to happen is people who are isolating or have been tested positive to then now come out of isolation, the test would have to go back to Accra, and this could take hours on the road, or they may not send an ambulance just for one person, so they might wait a few days so that the cases can accumulate before sending it off to the capital. What they've now done is they've got technology, drones, and they can take these samples, put them in ice packaging, put it into the belly of the drone, and then the drone flies off to like designated drop-off centres, and the healthcare professionals get like a text message as to when it's going to be dropped off, and that whole process can be done within half an hour. What could have taken hours on the road and many people is now being squashed down to half an hour. So that's just amazing. And this technology has been being used in Rwanda since 2016 for blood samples and medicines to rural clinics, but has now been repurposed for corona and expanded to Ghana. Next up we have Malawi. So Malawi is a country in the southeast of Africa with a population of 18.14 million people. Their president, Peter Mutharika, has given a tax break for small and medium businesses and allocated money to fight against corona. And where has the money come from? All top politicians have taken a 10% cut off their own salaries. That's quite major, I feel like, in Africa. So yeah, before there was a bit of strike / sit-ins with their healthcare workers because they didn't have enough PPE, but I think that has been taken care of now, so that's good. And lastly, the most potentially exciting or controversial is the herbal remedy that has been developed by Congolese Dr. Jerome Munyagi and presented by the president of Madagascar, Ndri Rajoelina. Sorry, I keep looking at my notes for all of these names. So the remedy, branded COVID Organics, contains the plant family Artemisia, and this plant family is already scientifically evidence-based remedy for malaria. This is quite interesting because the WHO have found in their trials, or are going to be doing a trial, because they have found that the anti-malarial hydroxychloroquine is effective against corona. And now there's this plant that Madagascar / Congo are saying is effective against COVID. But I have to say that the WHO does not stand behind the statement that this COVID Organics is a cure for corona, but does understand and did release a statement that herbal remedies are something that is important for Africa and is part of their healthcare. And I think this is quite true because I know my parents reach for like lemon and ginger when I have a cold before they reach for paracetamol. So the Madagascar president is very much behind this tonic, and Madagascar itself has had 193 confirmed cases but 0 deaths, and in all of my research I couldn't find any other countries that have had 0 deaths. So either way, Madagascar are going with this tonic. They've changed their stance from saying that it's a cure, and they're more now coming from the stance that it's a preventative. And they've made this tonic compulsory for all people who are vulnerable. So I know that they're giving it it's a compulsory for school children to take it throughout the day. They've been instructed to sip on it throughout the day. And Madagascar have exported this COVID Organics to 14 other countries in Africa, including Tanzania, Equatorial Guinea, Central African Republic, the Congos, Liberia, Guinea-Bissau, and all profits are going to fund further scientific research. At first we saw the myths that the virus is too hot to survive in Africa, or that black people don't get the coronavirus, but of course this has got no scientific evidence. So yeah, I just picked those 4 countries because I think that they were examples of great innovation and great care for all of their population, and especially looking after the poorest of the poor. Africa is a continent that is full of endemic diseases, unfortunately, so you know, other things like malaria and other pneumonias, unfortunately. So these things haven't just disappeared, yet they have been able to respond to corona in a proactive way so that this doesn't become just another deadly disease for them. And so far they're ahead of the curve. They're saving lives and saving money. Comment down below if your country was mentioned, or if you want to share any other countries' innovative ways. What do you think about this video? And yeah, share with anybody if you found this interesting. Alright then, till next time.